مشاهدين برنامج ذكريات في أيامنا، رمضان يحييكم من مدينة ملبورن الأسترالية. مرحبا بكم في برنامج ذكريات في أيامنا. اليوم هنكون معكم على الهواء مباشرة لمرة ثانية في الأسبوع. أمس كنا على الهواء، واليوم ماندي يوم خاص لأستاذ الصديق وأخ أبراهام أركاديو. اليوم هيكون معنا الهواء من تانيت في ملبورن. أبراهام، السلام عليكم.
السلام عليكم.
Yeah, welcome, Abraham. كيف حالك؟ إن شاء الله كويس. Can you introduce yourself to the audience of the Zifkrayat في Ayamina?
Okay. All right. Robert Lavalle. First of all, before I introduce myself, I'm going to say that, the program, Zifkrayat for Ayamina, is an innovation which you have. The Ayamina is actually a show which I personally supported because, you are able to bring people all over the world, basketball players, footballers, families, to talk on life experiences in peace, harmony, and love. My name is Abraham Mawgidia Arcadia Oromo. I'm a medical scientist by profession. I live here in Melbourne, Australia, and I work in pathology sector. Thank you.
Abraham, maybe I'll just mix it Arabic and English. So for you, just continue with the English. If you want to mix up Arabic, we'll be okay. So Abraham, I'm great and to see you in Zifkrayat for Ayamina. I'm very happy to see you here because we never get somebody like you, like writer and Orugo activist وكده. فيو ويلكم في برنامج ذكريات في ايامنا. عايزين نكلم المشاهدين بتاعنا برضو، خليهم يشاركوا الفيديو لاكبر عدد في كان عشان هم يشوفوا برادا ابراهام اركاديو في برنامج ذكريات في ايامنا. وبعدين برنامج ذكريات في ايامنا زي ما قلنا، برنامج ذكريات في ايامنا هو برنامج ثقافيه رياديه اجتماعيه. الليله حيكون معنا يوم ثقافي في حياه ابراهام اركاديو ابراهام اركاديو في ملبورن. فهو هيكلمنا عن حياته في هاي سكول، وبعد ذاك بعد اكسبيرينس احنا هنمشي فوقه. وطبعا الحياه ما انتهى في هاي سكول، لحد انتم شايفين هو بروفيشنال ناو دكتور، فهو موجود معنا في ملبورن. ابراهام، you're welcome. So I want you just to start from your high school.
Thank you.
Yeah.
High school.
Yeah.
All right. Well, thank you very much. I just want to say to you before I go to high school, when I was studying at Soritis Primary School, when I sat for my primary school certificate examination, my name was called among the first 100 students, in Radio Juba. Okay. After I finished primary school, I went to Torito 1, and then from Torito 1, I was actually accepted in Palachaka Secondary School. That was in 1982. Okay. So in 1982, I went to study in Palachaka. So in the first year, I completed first year, but in 1984, our school was interrupted because of insecurity in South Sudan, because at that time, the war was already at full swing. So the war in South Sudan started in 1983, isn't it?
You're right.
So that was the year that was the year I was supposed to go in second year. But because of the insecurity, our school was closed for 1 year. So my education was interrupted. So I had to go back to Torit, 1983. I was staying actually at home. I did actually try to go to Torit Day because Torit Day was still functioning. I went to meet Melchiore Lago-Damiano. He was actually the headmaster of Torit Day. I went to meet him in order for me to continue my studies in Torit Day. But he told me that the registration was completed and now I don't have a place. So that year I stayed at home. Now, after 1 year, 1984, I went back to Palatata Secondary School to continue my studies. I studied in Palatata up to 1986 when I sat for my Sudan School Certificate examination. So I just want to say that after we finished our science paper on that very day, we had messages. There were messages circulating that SPLA are in the area. Now, the actually students who finished their art section examinations, they left 1 day before. So we from Juba and Torit were actually staying at the campus, at our school. So we did not go because we didn't actually finish our examination. So the following morning when we finished the exams, our headmaster, Velino Otor, he took 2 students with him and also including our examination papers. So the 2 students he took to Juba were a young lady, but also there was a colleague called Lotelek. Lotelek is a chap from Mondari. Now the reason our headmaster Avelino took Lotelek, because as you know, during Kokora, there was this issue of fighting, between the Dinka and also Mundari. So he took actually Lotelek ahead of us. Now, the following morning, the SPLA came to our school. So there was a lot of chaos at the school, a lot of shock, because we were the only students left at the school. We from Torit and also a student from Juba. We had a colleague called Santo Ogide at Tagiamol. I think Ogide was taken by the SPLA, and also we had a chemistry teacher called Wilson Yuma. Wilson Yuma is actually from Uganda. He used to teach us chemistry. So Wilson Yuma probably was also taken on that day. So we didn't know where these 2 guys were. So we, the students from Juba and Torit, we decided that, okay, we had to, to go to Magui. So we took some food items from our stove just to take it with us. So we walked up to Obo. Obo is just about 3 miles from Palatata. And then we went to the sub-chief there. So the sub-chief authorized one of his drivers to take us on a tractor. Because, at that time, if you want to travel to Torit or Juba, you have to wait for a convoy coming from Pajok. And a convoy usually is actually, there are soldiers, okay? But at that time, there was no convoy not going to Torit. So we had to walk to Obo. Then from Obo, we took a tractor to travel to Magui. Now, because to travel on land at that time, it was actually rainy season. The roads are very, very bad. So we used a tractor to go to Magui. When we went to Magui, we went to meet Chief Ottaviano Ayat. Chief Ottaviano Ayat was stationed in Magui. So we went to him and tell him actually the problem we had. We told him that actually the SPLA came to our school They took a couple of, a teacher and one of our colleagues. And now we are in Torit and Juba. We don't have any means, to travel. So Chief Oyat gave us a small note to take it to a company called Hino. Hino? There was a company, they were working on the roads with these trucks. So we took the note from Chief Oyat. So we went to Hino company. We gave them the note, and then they said, okay, we're going to actually drop you to Pageri. Now, the road from Magui to Pageri was also, not good, because during that time, there was an election at that time, and one of the politicians called Kebulu was actually assassinated around that area. So it wasn't actually also safe to travel from Magui to Pageri. But thank God, we went without any problem. So this driver from company dropped us at Pageri. We stayed in Pageri for 3 days. So after 3 days, we had a bus coming from Nimule, and then we got on the bus, and then we went to Juba. After we arrived in Juba, of course, the students from Juba definitely went to their families. We had our families too in Juba, some of our family members. We went and stayed with them at night. The following morning, we went to the Ministry of Education. We from Torit, student from Torit. So we went to the Ministry of Education and asked them for any support because we want to go home. They told us that there's nothing that they can do. You basically go to your, relatives and ask them they can help you, so that you can go to Torit. So we went back. Actually, were disappointed. As a students, we did actually need the help of our authorities in Juba to help us, to go back home. So after a day or two, I personally traveled to Torit, to my hometown, and then I went to my village, Abala village. So I stayed in Abala village. That was around June. So there was shelling from Torit to Abala village. Some of the mortar shells actually landed near our village. My mom at that time, told me, also, it's not actually safe for you to stay here. Since you like school, you have to go back, go to Juba, so that you can continue your education. Now, I just want to say this on to you because my dad, he died in 1973. My elder brother called Casemiro, he told me, Abraham, I'm going to sacrifice my school for you so that you continue your education. I'm going to help, mom at home. I said to him, bro, that suggestion is okay. You can go and help mom. I'm very happy to continue with my education. This is why also my mom support me, because she knew that, I want to, study. I want to work hard at school. And he said, okay, you can go to Juba. So I decided, I said to mom, okay, no problem. I will leave to Juba. So when I went to Juba, I went and I lived with my cousin sister, Ikoki, with her husband, Peter Adava, who passed away. Both of them actually passed away. May God rest their souls in peace. I lived with them for a few days, and then I went to Superior Secondary School to enroll, to receive Sudan School Certificate. So I registered at Superior Secondary School, and then I started, schooling. I used to stay at Kato, but also I visited my current uncle, Professor Billy Madison. He's, the uncle we are very proud of, because he is actually caring, he's loving, he doesn't have any problem with any one of us. We like him so much, and he was always there for us. The sons and daughters of his sisters were always attached to him, for support, for any support. And, talking about Uncle Billy is not just going to end now here, because I'm going to move from Juba to Khartoum again, so we again actually with him. So I started in Supri that year. That was in 1986. And then Edna, his charitable wife, also study with me. So I used to go to their house.
Salam alaikum. We're in a Zoom. I'm in Zoom live.
Is that Dr. Hide?
Welcome, Abraham. Keep going.
Is that Dr. Hide?
No.
Okay.
From Torit.
Okay, from Torit. All right. I'm going to. I said that Mama Edna, we used to study with her in Superi. So I used to go to them in Riyadh, higher Riyadh, and I studied with her math together. So after I set my Sudan school certificate, the following year was 1987. I was employed by the Ministry of Education to teach at secondary school. So I was posted to Ecotus secondary school, but of course, due to insecurity and ongoing war in South Sudan, I couldn't go to Ecotus. No, Ecotus, that's how I would call it, but the owners say Ecotus. So I couldn't go to Ecotus to pursue my educational career over there. So instead, I was posted to teach at this place, school in Bullock. So in Bullock, we had, people who fled from all over around Juba. They came to Juba and settled over there. So there was a school open, for the displaced. So the Minister of Education actually posted me to teach, at that school in the afternoon. When I was teaching there, my subjects that I taught were basically biology and chemistry. So the students at that school actually liked my teaching methodology. Now, in 1988, during the notorious, Black October, Black October in Juba, actually, there was no food. That was the time I decided that I'm going to Khartoum to pursue further studies. Now, I'm going to pause here for a while, maybe if you have a question before I talk about Khartoum. And then if you have any question, I can answer before. Thank you very much.
Yeah, Abraham, thank you very much. You go from Palataka to Torit. So I just want to ask something, go back a little bit when you guys started primary in Torit. So that's very important for me to ask, because I know some of you guys being in Labarwa, 6 miles away from the school, coming every morning from there to school. What time you guys getting sleep? What time you guys waking up? And that far walking or running, or sometimes you'll be lucky has a bike. Can you just elaborate a little bit for people? They don't know how you guys really struggle going to school.
Okay, thank you very much. Because you told me to start from from college.
Yes, you're right. Thank you. Just remember this.
I just go over it quickly. But I just want to mention something before I talk about our traveling between Torit and Abalo village.
Yeah.
In 1972, just after the signing of Addis Ababa peace agreement, I, with my parents, including my cousin brother Mahjub, we used to live in a place called OPD. OPD is our safe haven, because during the war, we were living in the bush. So my auntie, Marcelina, she went, to OPD, and she went to bring us, myself and Mahjub, to Torit,
Yeah.
And she actually, when we arrived to Torit, her husband, Andrea Tulio, was also a very kind, man. They actually put us to a preschool. You remember there is a place near Angaur, and there was a place called Nyakuron. Where people used to, play in Nyakuron, or something like that.
Yes.
Yeah. Oh, yeah. We had a teacher called Marcelina, the namesake of my auntie. She used to teach preschool, pupils over there. So I and Mahjub all. So we start actually learning how to, how to write there. We're writing, ABCD on the ground and also the numbers 1 up to 10.
Sima Sima.
So in 1973.
This is Sima Sima.
Sima Sima.
Yep.
Yeah. And then, so after then, 1973, then my auntie put me to, to Toriki's primary school. So I stayed with my auntie until 1973. So we moved back to Abalo village. Okay. So when I moved to Abalo village, that was the time we started coming to Torit. So between Abalo and Torit is actually 6 miles. So we had to walk every day like 12 miles. I haven't calculated this one in kilometers. Maybe anybody who is listening to this conversation can calculate that one. You can know how many kilometers, because for us here in the West, we are using kilometers. But over there they use miles.
Miles.
So it's actually 12 miles a day. We usually start from Abalo village around 5 o'clock in the morning. We have a shower, we dress up and have something a little to eat. And then after that, 6 o'clock, we start walking, because the schools usually start around 8:30 or 8 o'clock. Yeah. So these are a couple of 2 hours is actually enough for us to walk from Abalo village. That time we were actually very young. So we walk from Abalo village up to Torit, this primary school. And then we get into the classes around 8:30. Now we study until, break time. Break time, we didn't have anywhere to go. If you have a family in Torit, like myself, I had my sister there, Matilde, the wife of Chief Rocco.
Yeah.
She's just close to the school. So I can walk there if I want to go and eat something. I can go to her house. But most of the time, we go to River Ganaji to have a shower. You understand?
Yeah. Yeah, I enjoy that.
Yeah, so we have to go to Hinadi during this break time. We have a shower quickly and then go back to school. So we go back to school after that, then we go back to Abalo village. We usually arrive there maybe 3 o'clock or 4 o'clock. And then we can, stay the night. But I just want to tell you, because Abrum, study, we're actually working hard under difficult situations. We didn't have enough facilities. We didn't have books, no library, something like that. All the notes we write on our exercise books. Like during the weekends, we just have to walk around, the mountain. We read, in the morning. Sometimes, even in the afternoon, we just walk and read, which is all we've been working hard at school, under limited resources. So that's we managed to travel between Torit and Abalo on those particular 5 or 6 years from primary, but also if you are accepted to reach one intermediate school, which I was. So also we still come from Abalo, between Abalo and Torit, to Torit one intermediate school. So the same thing, going on, going to Ganaji, have a shower, and going home. We don't have enough money, we don't have enough food, but we manage here. That's the way, we survive.
Yeah. So you guys, were you guys walking in the road? Sometimes you running or just like do what we say, like I've been a village sometimes when they come from the school.
When you come late from the village, hello? Yeah, you can run,
yes.
Because you need to be there on time. So you
when you come late.
Yeah, if you want to go to the village, you can still run if you want to. You can run, but usually we go in groups. Yeah, we work in groups. Yeah, we chat on the way, we play. We run, we jog, something like that, until we reach the village.
Okay, Abraham. So from here we go to Khartoum again. I know in Khartoum people struggle a lot to go to school, and by that time, no English schools. Just might be missionaries helping people, and after that, God helped to make a school for South Sudanese, those one in Khartoum. So how do you go to school in Khartoum? How do you just found the school?
Okay, Brum, when I went to Khartoum, just to be honest with you, I was interested to study medicine. But because I didn't actually obtain sufficient marks for me to be able to go directly into medicine, I decided that I have to go to Khartoum. Maybe I can find a school there to continue my education, or possibly I can travel to Egypt. Because most of the students who finish their examinations in Juba or Palataka or law or something like that, a few of them actually went to Egypt and finished their studies. Okay, even if they didn't actually obtain high marks. All right. So I went to Khartoum to explore options, to continue my education. Now, while I was in Khartoum, that was 1988, just at the beginning of 1989. So there were rumors circulating in Khartoum that there is a World Health Training Institute is recruiting Sudan school certificate leavers from South Sudan. They want to train this group of people to be like, like foot doctors, they call it barefoot doctors or general medical technicians. They could go to, because the institute was initially was in a war. Now, because of the war, they had to transfer a health training institute from Wow to Medellin.
Medellin.
So, Wad Medellin, yeah. Yeah, our institute was in Wad Medellin. Now, the staff from for Health Training Institute, they came from Wad Medellin to Khartoum to accept South Sudanese students to study this diploma in preventative and curative medicine. So I went to Comboni College, and I found a group of South Sudanese students who are like myself. They completed high schools. They had good marks. They passed well like myself. Who were there? That was our principal called Pamela Mariel.
Yep.
And then we had Professor Giovanni Giannone. He's from Italy, but he works at our institute in Wad Medellin. So they came to Khartoum to recruit the students, to do this diploma in preventative and curative medicine. So since I was actually interested to study medicine, I thought, okay, this is a way for me, like a stepping stone to continue my future studies. So at Comboni College, on that same day, they gave us an interview. It was a written interview. So that written interview was sciences. It was basically biology, chemistry, physics, and also mathematics. Yeah, because since we done, secondary, we completed secondary education, all the questions they provided that day, they were not difficult. We were good at mathematics, calculus, things like that, trigonometry, all these things. Most of us were very good in mathematics and also in sciences. Throughout my education, I study sciences. I don't study arts. So I sat the exams. We sat the examination, and then the same day they told us who was successful. I was successful. The other colleagues were also successful. Just after 1 week or so, they organized a bus to take us to Wad Medellin. So we went to Wad Medellin. We were dropped at the University of Jazeera Medical School, College of Medicine. At that time, the students were still on holiday. So we had a couple of weeks, staying in the university. And then they found for us a place just across the road, close to College of Medicine. So we stayed there. We started our courses. Our courses were started by learning English and basic medical science, because if you want to study anything associated with medicine, you have to know English, and this English, most of the time, they have got Latin, like above is called supra, on the side is called lateral, things like that. So, to lie on the back is called supine, and to lie on your tummy is called prone. So you need to understand the terminology, okay? Like the heart, they call cardiac, things like that. And the lung is actually pneumo. That's why you have, when people said, okay, he has pneumonia means something in the lung. Yeah, pneumo, all right? So we started learning English and basic medical sciences, and we finished it. It was an intensive course. And then after that, we start learning anatomy and physiology. Now, Professor Giovanni, the Italian I mentioned before, used to teach us, anatomy and physiology. Now, if you want to diagnose diseases, you have to know pathology. You have to know pathology means patho means disease, and logy is study. Okay, so pathology is the study of disease. Okay, and anatomy is the study of human body, and physiology basically you have to learn how the body functions. All right, so all the systems in the body, cardiovascular system, respiratory system, central nervous system, you need to understand all those ones, so that if a patient comes to you complaining, telling you what they have, because you learn pathology, you learn physiology, you learn anatomy, you know where the problem is. Okay, so in medical terms, we have something called. I will talk a little bit more about this when I talk my experience working for Médecins Sans Frontières, MSF Holland.
Okay.
So
yep.
When a patient comes to you, we do something called you have to clap the patient, means do medical examination. So the medical examination consists of, you have to take the history of the patient, ask the patient their name, their age, date of birth, and then ask them what the problem is. And now, if you want to be a good clinician, you have to listen to the patient. You should be a good listener. Okay, don't interrupt the patient. Let them talk, and then you just ask leading questions. Because while you are asking leading questions, you want to know exactly, what they are, so that they say more about what they are talking about. Okay. Yeah. So it is important to know those subjects. Now, we had Dr. James Okello. He was our course coordinator, and also actually taught some subjects in medicine, but were mostly taught by the doctors, consultants, and professors from Jazeera Medical School, because most of those are professors, doctors. They work within in the hospital within Jazeera in Medellin. Okay, so I'll say a little bit more about this when I finish my studies in a health training institute. Yep. So at the health training institute, when we went there, third year class. This third year class, they were brought from WAM. They were not taken from Khartoum, but the second year, they were actually taken from Khartoum. So we were the second batch, okay, selected from Khartoum. So we were in the first year, that year, in 1989. So I studied there in Medellin for 3 years, and I finished my studies. I obtained my diploma in preventative curative medicine. I done very well. I just don't want to, to mention, what I did or what I did not do. But maybe I can point one thing. I scored 100% in dermatology. Dermatology is the study of skin diseases, 100%. Okay. So after I finished my studies in Medellin Health Training Institute, then I did what is called internship. So internship, I have to do 3 months in every department. Okay. So in Medellin teaching hospital, there is There is internal medicine, which is medicine. There is obstetric and gynecology,
No.
Okay. Yeah, and also there are other departments, like psychiatry or dermatology within there. But pediatrics was separate. The pediatric is actually to do with the children disease, Amrad or Museshwar. So pediatric is separate. Now, before we graduated, after doing all these basic sciences, chemistry, physiology, whatever, we were doing clinical medicine, as I said before. So all of us were divided, to go to the hospital. At the emergency department, there are doctors working there. So we from Health Training Institute, students from Health Institute, you go to the emergency department and you start, tracking patients, taking the patient history, examining them. You put a professional diagnosis. Professional diagnosis is something you said, okay, I think this patient has got this condition, but still you need to prove it. You understand? But if it is just, like what happened here in Australia, you go to your family doctor, you just have a cold, you have a running nose, you have sore throat, or you cough a little bit, and then you go to the doctor says, oh, how can I help you? So you tell him all these complaints. He can check your throat. I say, okay, the throat is all right, it's not red. And then, you don't have fever. He can say, okay, just take a painkiller and drink a lot of water. Isn't it, our group? Yeah, they will say this one because you don't need any treatment. Okay, you don't need any treatment. But what is happening, in Sudan or South Sudan? Some people, particularly those in the rural areas, I work in Amkura. If some patients come like that, if you're really ruthless in your prescription, somebody just have a mild cough or maybe there's no fever, they usually prescribe them antibiotics. Mudat al-Hayw. So you see the excessive use of antibiotics. Like now, people talk of some of the bacteria become resistant to antibiotics. So you don't need to give antibiotics to patients unnecessarily. Okay. Yeah. So during our clinical practice, we go to the hospital. You take histories. You take clinical examination. You examine the patient. You put a provisional diagnosis. You probably have to write a slip so that they can do some tests, because you need to confirm the diagnosis that, okay, what I thought the patient had, the patient should do some blood testing so that then you can confirm that they have got the condition you thought about. So also, before we graduated from Health Training Institute, when we have our clinical examination, you have a written examination. You write a written examination, you finish, but you have a clinical examination as well. So you go to the hospital, the doctors are there who are actually, testing you. So they can just, if you have two cases, they can just say to you, examine the chest of this patient. Now, when they say examine the chest of the patient, you have to think two things. Either the patient has got a problem in the heart, or the patient has got a problem in the lungs. You understand? Yeah. So now, when they say to you, examine the chest of this patient, you first of all need to assess the patient clinically, check their pulse rate, check their breathing. When they're lying down, you have to count when they are breathing. When the patient is breathing fast, you know that the patient is breathing fast. Okay. If the patient is breathing slowly, you also know. You have to count the breathing, the respiratory rates. And then after that, then you feel the heart. Sometimes when people have heart problems, maybe the heart is beating, or you can see, the heart, like palpitating, palpitating, like that. Particularly,
which hospital did you go? Did you go to the training on? In Khartoum.
Well, okay. Let me just finish in Medani.
You're welcome.
Before I go to Khartoum now, in Medani, as I said, I graduated. So
yeah.
I have to do 3 months in every unit. They call internship. Okay. There is something wrong forgot to tell you, because when we were studying at Health Training Institute, we were supported by the government of South Sudan. So they used to give us some, bursaries through the office. There was an office here near Sharisitin. What was it? What was it called?
Coordination office. Coordination office.
Right, absolutely. So coordination office. So we used to come to Khartoum to coordination office, get our, bursaries to help us, purchase, soap or some clothing, something like that. So also when I was doing my internship, I lived with my sister, Iromo, the daughter of Celestino. And also, those of Tuyur.
Yes. Okay. In Medani, yeah.
Medani and Yavok. And also I had my uncle Farid.
Yes, yeah.
With his wife and children. I used to visit them. I used to stay with them when I was doing my internship. Because by that time, all the students left. Most of the students doing work placements, they stay with their relatives. So I stayed with my relatives in Wadmenen until I finished. So I did pediatrics in Wadmedani. I did surgery in Omdurman. I did skin diseases in Khartoum Teaching Hospital. The dermatology hospital, they call it skin diseases and venereal diseases. Venereal diseases, these are diseases transmitted, through, contact, sexual contact. So I did 3 months in skin disease in Khartoum Teaching Hospital, and also I did surgery in Omdurman. When I was working in, I just want to tell you one interesting case.
Yeah.
Because I want our children, our although young ones who are interested, to pursue the career like what I'm talking about, even though I haven't actually done enough, because, at the moment I'm not practicing in this country. Okay. I train as a medical scientist. Now I'm now doing testing instead of seeing patients. So we don't have any contact with the patients now. We do the test in the lab and then, we provide the results and like that. But our students, our children who are interested to pursue careers, such as what I did last time, that's why I'm talking all these things. But somebody probably will say, Abraham, why are you all talking all this? This is the fact. Okay?
Yeah.
This is the fact. I'm not, I'm not perfect. I can make mistakes too. I'm a human being. But I just want to, tell that this is what is happening in the real world. Okay. So when I was doing my work placement or internship in Wadman and in pediatrics, I work in a unit. Within the hospital, there is a specialist.
Yeah.
So you'll be, you'll work under a specialist. So in the pediatric hospital, I work under Fatima, Dr. Fatima. She's a pediatrician. She's a consultant. She taught us also pediatrics when I was doing pediatrics. So after I finished, I went and practiced in her department. I was working with a doctor called Dr. Hind from Wadmedani. Dr. Hind was a registrar. A registrar is a doctor who is actually practicing to become like a consultant. You understand?
Yep.
So they are basically, yeah. I was like a junior with other junior doctors. I'm from Health Training Institute. I'm not a qualified doctor, but we work together with them. Okay. So there are junior doctors. There is a registrar, and then myself. All of us are working. We are looking after the patients. So on that particular day, Brooke,
yep.
We had a consultant called Hassan, Dr. Hassan, Professor Hassan. He used to teach us pediatrics as well. So I was working with Dr. Hind in the pediatrics emergency on that day. I was on duty. Now on duty, usually there are maybe at the beginning, around 6 o'clock, 7 o'clock, maybe there are 3 or 4 other junior doctors working with the registrar, but also I was there. Sometimes it happened, maybe you are only 2. So on that particular day, I was working with Dr. Hind. But Dr. Hind, because he had a friend who set an examination in Khartoum to become a specialist, so she organized a party. So they went along the river bank, to have some sort of celebration over there. So she left me alone, in the emergency. So it was about 8 o'clock or something like that. I was working by myself in the pediatric emergency department. Now, Professor Hassan has sent a very sick child. This child was just only like about 3 weeks, Abrum. This
Wow.
child, very little child. The child developed septicemia. Septicemia اللي هو تصمم في الدم. Okay, تصمم بالدم. Now this child is bleeding from everywhere. Because septicemia probably can cause hemolysis and affect the clotting factors. The clotting factors are the factors which stop us from bleeding. You understand? So if those all clotting factors destroyed, you can bleed from anywhere. So this child was very sick. The child was pale like, when you open the conjunctiva on the eye, you can see they are very, very pale. You know that they are very anemic. And this child was breathing, heavily. We call it actually, in medical terms, it's called dyspnea, meaning that the child or the patient having difficulty in breathing. Okay, so this child was breathing very fast, and he was very pale, sometimes faint blue, something like that. He was nearly dying. So Professor Hassan, because these consultants, when they send the child to the hospital, they already provide a prescription. Bro, he said to me before, you can speak in Arabic. I can speak some Arabic, but I don't know Arabic, I had a hatred in Arabic, but I tend to be wrong, honestly. There's nothing wrong in learning a language. I will go and talk that one later when I talk about Urdu language. Yeah, but when I was in Medellin, I had to learn, when I was, doing my internship, I had to learn how to write prescription in Arabic. Jura or Jura Benslin Mai. I have to write it in Arabic, honestly. Even if the doctors, they were actually using English in communication, but mostly, their prescription, they write in Arabic. Okay, so they brought this sick child. He said this child should receive blood. This child should be given, intravenous injections. The child has to, intravenous means the child has to get the treatment through the veins. Okay, it's called intravenous, not intramuscular, because the child was too sick. So everything has to be given intravenous, bro. Now, you are somebody working in an emergency situation like that. What do? You quickly, take the request list from the doctor. You read what they wrote, and then you can just ask the parents also what the child has got. You take your own history and write it down, plus the findings of the consultant. Okay? So that time, since the child was actually, he's anemic, he's dying, I had to call a driver. There was a driver in the pediatric hospital in Ward Medicine. So I called the driver. I went with the driver to the blood bank. Now this child, because we can't take blood from him, he's a small child. You have to go to the blood bank. You can get a negative, rhesus negative blood, which is actually used in emergencies. It can be given to that child without causing any problem. All right. So I went to the hospital in Ward Medicine Teaching Hospital at the blood bank. I took the blood. We brought it to the hospital. I took the child in the ward, and then in the ward I have to do what is called a cut down. A cut down is, on the leg, okay? You have the ankle on the leg. You have got on the ankle. You put one finger like that on the ankle, and then it is like that, and then you can cut. You cut with a scalpel, a small little knife. You cut it a little bit. You don't cut deep. You cut a little bit, and then you hook, the vein. There is a vein there, little vein, from the baby, from the foot. You hook the vein up. When you leave the vein like that, you can then use a needle. Just take a tip of it, a little bit of it. You snip it, and then you take a polythene rod. That is a small polythene rod. It's white. It's small like that. It's a small tube. So you insert the tube into the vein, slowly up to inside there, and then after that, if it is in the vein, you take a normal saline on the syringe, and then you put it. You want to check, the vein is open, it's running. So you test it with a normal saline, or military. You test it slowly until all, normal saline is finished. It means that actually the vein is okay. Then you can, transfuse the child. Now, it is important to know the weight of the child because everything has to be calculated according to the weight. Because if you don't get the weight correctly, you're gonna give too much, you're gonna kill the child. All right, so you have to know the weight of the child. You have to calculate how much blood. The blood is actually like 100 mils. It's a big one. Okay, they can have for the children one, but you can sometimes use a big one, but you have to put a mark on. You calculate, after calculating it, you put the mark, and that's what the child can get. They can get that one slowly. Now, what happened, when I was doing this procedure, the mother actually collapsed. The mother collapsed because, she didn't like, the thing I was doing to the little child. Yeah, but it was good that there was the nurses there, they take care of her. And then after I finished my procedure, I put the blood that was running. They gave the injection intravenously, all working well. So, we dressed the wound. I told the nurse, please, you have to take care of the child. Let the child not cry and pull, the rod, the polythene tube off.
Yep.
So I went back into the emergency. I went to the patients. I was there working by myself. I haven't actually called Dr. Hinz yet because they were there celebrating. They were enjoying the party. I saw the child is getting the treatment. Abnormal, this child actually got some little blood. He improved.
Wow.
The child the breathing was okay. He got the, antibiotics. But the problem was just after half an hour, he pulled out the tube.
Man.
Again, the child started bleeding, getting, difficult breathing anymore. Now, I, as somebody who was working there, I had to take a decision. Now, in Sudan or South Sudan, probably, you can't do what is called bilateral cut down. Bilateral means both sides. Because I did the cut down on one leg, the other leg, you're not supposed to do it. Because in the future, if a child has, severe diarrhea, okay, they lost.
Put your voice on. Your voice off, Abraham. I can't hear you. Your voice off. You put your voice off by mistake.
Abraham.
Yes.
Just a minute. My son just finished work. He's calling. I'm going to tell his sister to go and pick him, okay?
Oh, no worries. طيب مشاهدين برنامج ذكريات في ايامنا، عايزين نقول سلام لكل الناس اللي بتتفرج علينا. عندنا دينا ريميس، مرحب بك دينا. نادية أوبير، مرحب بك. الفونس وهيك، مرحب بك. ويليام، سلام عليك. ويليام سابينو، يا مرحب. اخت حلن، ازيك حلن؟ هنا عندك رومويان، السلام عليكم رومويان. اخونا فونس، مرحب بك. بنتي نايت، مرحب بك. سوكا، اهلا وسهلا. ابراهام، سلوى ابراهام، يا مرحب. جون، جاستن، اندرو، مرحب بكم يا جماعه. مرحب جاستن لكم. كيف عاملين؟ ان شاء الله كويسين. صراحه يمكن في ناس انا ما شفتهم، فالليله حنكون احنا معاكم في الهواء مع الدكتور ابراهيم اركاديو، معنا في ملبون، ويكلمنا عن حياته بدانا من ابتدائيه لحد هسه مشين للبروفيشنال بتاعه. هو طبعا بقى راجل طبي وشغال في حتات كثير بتاعت مستشفى. ابراهيم، مرحبا بك. Welcome back, Abraham.
Thank you, Abraham. Now, I just want to say that now this child, after the tube came out, so I have to decide that I have to do the cut down on the other leg.
Wow.
Which I told you before, you not do it. But, because for me, I have to take that risk and decide what is actually best for that patient. So I decided to do a cut down on the other leg.
Wow.
Okay. So, yeah, I succeeded again. We gave the child the blood, and then I called for help. Okay. I called for Hind, Dr. Hind, who was actually my supervisor. Okay, because she's a registrar. I called her to come and help me because I was also alone. I need to see other patients.
Yeah.
So I sent for Dr. Hinz. Now the driver went there. Dr. Hinz won't still enjoy the party. So he sent another doctor. So that doctor came to me. He said, okay, Abraham, let's take the child up in the surgery room. So we went there. We tried to put the thing again, the tube. And then we gave the child also vitamin K, because vitamin K will stop the bleeding. Yep. So we gave the patient the K, and then we put the tube back, and then the child received the blood and get the treatment like, normal. So until morning hours. Now what happened is, if you are working with the hospital, within the hospital on the duty, you have in the morning, the consultant come from home, you are going to do the round. Okay, so you have to see your patients, but also the doctors who send their patients for you to admit them in the ward, they're also going to see those patients. Now, Professor Hassan, he came because he knew the child was very sick. He went to the ward and found the child was okay, was receiving the treatment, but 2 legs, we did the cut down on 2 legs. And then he went to Dr. Fatima, and asked Dr. Fatima, who was working yesterday in emergency. Dr. Fatima said Abraham was working there with Dr. Him. And he came to me and said, Abraham, who told you to do a bilateral cut down? Who told you to cut, both legs? I said to him, Professor, the child was dying. Now, when I did the cut down on the other leg, on the left leg, for example, we gave the blood. The treatment was going on, but at the end, the child pulled a polycene rod out. So for me, I have to decide, I don't want the child to die. I decided to do the cut down on the other leg. He kept quiet, Abram. He didn't say anything. Then he left. Now, when I went to Khartoum doing, my training in dermatology, Amrad Jildia, the father, he came, I was there. He came with this child. The child I saw in Medani.
Medani, yeah.
This child I saw in Medani, he grew very, very short, big as Gosair. Okay, but because of, like septicemia allure to some of them, it can affect, the growth factors of the brain. Yeah, the hormone. This child grew very, very short. And the father was calling me, doctor. I said, who is this? I turned around, this is the child you saw in my belly last time. I said, really? So he came, this child had developed skin problems. We had what is called eczema. Eczema is just like an allergic reaction, but, you get a lot of, lesions or wounds around which are oozing like water, but also very itchy. So we saw him also at Khartoum Hospital. They gave him treatment and then they went back. So this is my experience, in the hospitals in Khartoum. Thank you.
Okay. So how did you join the MSF?
Right. Okay.
Is that the first? That the first work for you after you finished college?
Yeah, I finished Health Training Institute. I got my diploma in medicine. So I did, the training I am talking about. And then after I finished my training, then it is for me now to decide to look for work. Okay. So MSF Holland in Khartoum were actually employing people. So I went there and applied. They take me as a part-time worker, because the Lesmania Research Group. Lesmania Research Group. They were from the University of Khartoum. They work at the Stark Laboratory. There was Professor Ahmed Mohammed Hassan El Hassan. This guy, he was doing research since 1958. So he was able to, when he was doing his research assistant job, he saw the first case of Kalaza in Gaddafi. Kalaza, I'm going to talk about it in a minute.
Yeah.
When we are only one country, like Sudan, we have actually what they call three foci. Three foci, these are One is called a focus, one is Eposide, but it is a place. I'm going to use, basic language, means a place. So there are three places of Kal-Azar in Sudan that time. One is in Won, it's called Western Upper Nile. There were cases over there, and this disease, 95% can kill without treatment. Okay, it is also found in Torit up to Capueta, and also it is found in Unity State. Okay, but in the north, it is in Gadara. Now, people who used to go, what they call jungle, those people who are going to do the harvesting, they can get the disease there during that time. In around Salala, Omkura, particularly Omkura where I work, they have these outbreaks of Kal-Azar. Kal-Azar is called visceral leishmaniasis. Okay, it was initially started in that. I think the doctor who discovered it, he was in India. Okay, Kal-Azar is like a language of Hindi. Okay,
yeah, right.
Kal-Azar means black disease. Now, this patient who have Kal-Azar or visceral leishmaniasis, they have these black patches. That's why they say actually Kal-Azar. All right. Now, Kal-Azar, as you people probably be, aware of, in Khartoum, there was, a wound on the skin called Zobaba Romlia.
Yes, yes.
Have you heard of Zobaba Romlia?
Yeah.
Yeah. Zobaba Romlia. Yeah. That Zobaba Romlia, it is actually Kal-Azar of the skin. Okay, it's called cutaneous leishmaniasis. Cutaneous. Okay, it is Kal-Azar that affects the skin. All right. The treatment is the same, but the one in Gadaref area in Eastern Sudan, this one affects the internal organs. Okay, it affects the bone marrow. The bone marrow is a factory of our blood cells. Now, this disease is transmitted by a factor called sandflies. Okay, these sandflies, they live in small shrubs, in small trees called Acacia aegyptica, okay, or Acacia thayal. These small flies, they live there, the sandflies. They come at night time at dawn when the sun goes down. They come and they bite people. Now, they are not like mosquitoes. You don't feel the bites of sandfly. Okay. Now, if you don't have immunity, which is the resistance to it, you can develop the symptoms maybe after 3 weeks or maybe a month. It starts like malaria, like fever. At the end, you start developing the swelling of the lymph nodes. The lymph nodes in Arabic they call Gudda al-Lefawiya.
Ah, yeah. Gudda, yeah. Yep, you're right.
These are small lymphatics. Usually they drain, the blood, the white blood cells, and then they can also destroy any infection. So Gudda al-Lefawiya, with this patient with Kal-Azar, they start to become big. It's called lymphadenopathy. So it can be around here and also here. It's called inguinal in this area. Okay, they can lose weight. This patient lost weight. Now, because this disease affects the bone marrow, they don't have the resistance. They can have a secondary bacterial infection. They can have like coughing. They can have chest infections. They can have tuberculosis. They can develop TB. They can come with TB. But still, when they are coughing, you need to test the sputum, for TB if they are positive. All right. If they are not positive, they produce sputum. You can then say probably have a pneumonia. You treat them with antibiotics. Now, when MSF actually employed me temporarily, they sent me with this group from the University of Khartoum. So I and my junior colleague called Pius Oteno. Pius Oteno also graduated from Health Training Institute. But with me also there was Dr. Edwin Sosimo. Probably you guys know Dr. Edwin. Dr. Edwin Sosimo and also Dr. Thomas Madit. So they are our team leaders from MSF. And then it was me with Pius Oteno, but Dr. Edwin and also Dr. Thomas. So we went with the LRG, these doctors, consultants or researchers from the University of Khartoum. We went to Salala. Salala is just about, like about 3 miles from Amkura. So I and Oteno, we opened our small clinic. Dr. Edwin was there, like our supervisor, our leader, and also Dr. Thomas. So we opened our small clinic. Like before, I told you, clinically, you have to know, you have to know anatomy, you have to know physiology, all these things. If patient coming, you know why the patient, ask them why they are vomiting, things like that. You need to stop the vomiting so that they don't lose the fluids. All right? Because when they lose the fluid, they become dehydrated. So we're examining these patients' room. We look at the patient, we call them in one by one because there was an outbreak of Kala-Azar, of visceral leishmaniasis. These people come in large numbers. So these researchers basically during the outbreak, which is the outbreak of, it's not like the outbreak of COVID-19, okay? That outbreak is only in a specific area, okay? So it affects quite a few people, but it's actually very deadly, it can kill. Now, if it is not treated. So we saw the patients, and then we examine the patient, we give them a slips, and then we refer them to the LRG, which is the Leishmania Research Group. So then these doctors and scientists, they take the patient sample. They take the sample from where? We have the lymph node. I told you that they are swollen, the lymph nodes. You take an aspirate with a needle from there. And then you put it on a slide, leave it to dry, and then you fix it, and then they stand there. So they can look then under the microscope. If they can see the parasite, the parasite is called Leishmania donor antibodies, So these patients will be diagnosed positive that they have Kala-Azar. Now, when they are diagnosed positive, they have to receive the treatment. Now, their treatment, it takes 30 days. Now, they receive a drug called pentostam, sodium stribogluconate. It's 20 milligrams per kilogram body weight. Now, as I said before, it is important to record the weight of the patient because some drugs usually you can calculate. You need to calculate their dose. Otherwise, you're going to kill somebody. The drugs, when you are studying any medical school or anything associated with medicine, you need to understand also how the drug work or interact with other drugs or how the drug work in the body. They call it pharmacokinetics or pharmacodynamics. Okay, so these patients who are diagnosed positive for Kala-Azar will be admitted for 30 days. They receive the treatment in place because you need to treat them sometimes when they come with the infection. You need to treat them as well. So after 1 month, this group from LRG, they decided to go back to Khartoum. So they left me with Pius from MSF, Dr. Edwin as well, and Dr. Thomas. They went back to Khartoum. So they left me with Pius Oteno to supervise the treatment for the other people. Now, let's say we open the clinic today. Somebody who is diagnosed today will finish his treatment, early, isn't it?
Yeah,
but those people who come maybe 15 days later, they're gonna finish their treatment later. So the people we saw on the first day and they got the treatment, those ones finish within 30 days. They, we discharge them, but still we have to, wait for the other people. So our team from MSF say, okay, Abraham, you have to stay with Pius. You have to supervise the treatment. The nurses were employed from the area, to give the injections. So we are basically there giving them, that drug, pentostam. Pentostam in Gadaref area is a very important drug. If you leave, anybody can steal it. They're gonna sell it at, a high price. It is a bottle which consists of 100 millions. Okay, so this medicine can cost $100 US. Now, at that time, the government of South Sudan cannot treat this patient. That's why, non-governmental organizations such as MSF Poland, which I work for, can go there and give free treatment. Okay. So after all those patients finish their treatment, Pius and I, our driver, because they left us with a car, then we went back to Khartoum. After we went back to Khartoum, just after a few days, they called me to the office. They say, Abraham, we want you to go back to Amkura to open a treatment center. So again, Dr. Edwin, they employed other colleagues, and then also a nurse called Malek Makur, from from Nuer. Malik worked actually in Upper Nile before. He's a very tall guy, you know, he was a very good nurse. So we went to Omkura. We went also with, I don't know whether you know Bortel Paulino. He worked for MSF also that time, but he works in logistics. So we had, you know, as a team to open a clinic, you need logistician, you need people in finance, you know, to release the money, you know, the funds for your food, you know, also they can buy things. And so that time, because we have to build a treatment center, so they have to buy, you know, the bricks, they buy, you know, zinc, something like that, you know, to start building our clinic. So they were building our clinic, but we all, you know, we put a canvas. So I and our colleagues, I think Peter Rosva was with me. Peter Rosva, he's now working in Torek Hospital. Peter worked with me there in Kasab, but also we had Ojet Arcangelo. Ojet is in the United States, in America. So we work with there, we see the patients, we admit the patients, we follow the patients. I was actually selected as being in charge. So Edwin, Dr. Edwin was our top, you know, like top supervisor, because he's a medical doctor, but also he was like also managing us. But I was supervising, you know, the medical staff. So with my experience as a supervisor of the clinic, but also, you know, doing my clinical work, I do both of them together. Yeah, I see the patients prescribed, send them for testing. We have our local laboratory. You know, we have a lab technician with us also, you know, to do the testing for this patient with Kala-Azar. So we admit many cases, you know, those cases, we admit them in the treatment center, we treat them for 30 days, as I told you. Now, when our work load become more, they send to us more people from Khartoum. So I work in Omukura for 3 years. And then my colleague, my junior colleague called Joseph Ringos, who was actually taken from Khartoum to replace me in Omukura, because I had to go to open another clinic in Kasab. Kasab is just about 24 kilometers from Gadari. Okay, so I was transferred. I with Peter Rosova. We had other colleague from our institute also employed. We had Peter Young. We had Simon Losio. We had also Michael Nyang. So all of us working, also Emmanuel Badam. All of us were working there. We got another chap, you know, from Masalit called Mohammed Ahmed. He was working in nutrition. Now, you know, these patients, particularly the children who are sick with Kala-Azar, they are malnourished. Now, malnutrition, you know, somebody who is actually very fat, okay, as in Australia now, they don't say to somebody you are fat.
Yeah.
They don't want us to use this terminology anymore. But it's just crap. You know, you can't deny the fact. You know, the body mass index. You need to calculate the body mass index to know that whether the patient is obese or they lose weight. Now these children, they have malnutrition. Now mal, as I told you, is a Latin word meaning bad. So if you are very fat, it is malnutrition too. You know, if you are very thin, you know, you don't eat well, you also malnourished, your weight is very low, you also malnourished. So malnutrition is not only for children, you know, who lost weight, okay, but also people who are fat, okay? Right. So it's called malnutrition. Now, those children with Kala-Azar who are malnourished, we measure their arm circumference. You will be able to know if they are malnourished or not by measuring their arm circumference. You weigh them up, you know the weights, and then you can calculate, you know, the weights, and then you know they are malnourished, then you admit them in the ward. Now, while they are taking treatment for Kala-Azar, according to their body weights, they're also taking nutritional rehabilitation for that particular 30 days. Now, patients who develop tuberculosis during treatment, we isolate them. Also, we treat them. We give them also treatment for TB together with the treatment for Kala-Azar. Now, Kala-Azar, after 30 days treatment, well, we do something called a test of cure, TOC. A test of cure, you want to check that the patients are, you know, they have treated completely from Kala-Azar. Okay, so we take another sample, another lymph node aspirate. The lab technician can check it. If it is negative, we actually discharge the patient to go home. If they are positive, still positive, we admit them for extra 15 days. We continue giving them this treatment, sodium sevoflurane or pentastam, until another 15 days. After that, the patient actually got treatment for 45 days, then we take another sample. If they are negative, then we discharge them. Okay, so we work like that, But when I went to England, actually, when I moved to Kasab, my wife, my beautiful wife, Rebecca, used to live in Khartoum at High Sidat. So I went and transferred them to Gadar with our daughter, Letitia, at that time. So Doris was not born yet. So we moved to Gadar. So we live in Gadar. And I traveled to Kasab because Kasab is just close. It's about 30 minutes from Gadar. So I brought them very close to me. And then I keep traveling between Kasab and Gadar, also supervising the clinic. But we have got all these guys, our colleagues, our junior colleagues. They also employed another doctor from Wadmeden. He's called Dr. Zahir. So Dr. Zahir was working with us in Kasab. So he was also supervising us, and we can consult him if we have any difficult cases. So we can talk to him. We can manage the cases. The cases we can't manage within Kasab. If they have other medical problems, we transfer them to Gadarib Teaching Hospital, so that they can be treated there. We can send them with their treatment. Like pentasam, we send it we calculate the dose, and we give it to them. They go to the hospital so that they can get the treatment for the other medical conditions. So I worked in Kasab until 2000, and then I applied to do a short course. It's called a certificate course in tropical community medicine and health. This course was at Liverpool School of Tropical Medicine in England. So I applied to the university. They accepted me. MSF said, Abraham, yeah, of course, we approve. We're going to send you for your training. And then, you can go. So in the year 2000, I traveled to England. But there's one thing I forgot, Broom. When I was working in Omkra as a clinic supervisor, Dr. Jill Siemens, she's an American, she's from Alaska. Dr. Jill Siemens, she's a specialist of Kalaza. So she worked in Western Upper Nile for a long time, even during the war, during this war, SPLA war. Jill Siemens lived there. She speaks, Nuer language. So wow. She came to us in Kasab. She stayed with us in Kasab because she traveled all over the world, the places where people are sick with Kalaza. This is her work. She done a lot of research work in this area. So Dr. Siemens came to us. She was in Kasab, in Omkra, when I was still there before I moved to Kasab. Our organization, MSF Holland, said to me, Abraham, we are going to send you to a conference, a Kalaza conference in Addis Ababa, Ethiopia. You have to go with Jill Siemens. I said, okay, that's all right. I will go. So they told me, they said, okay, you have to go to Khartoum to process, the traveling documents. Because at that time, I didn't actually process my passport, but also other ID cards, to travel for, to enable me to travel with Dr. Siemens to Ethiopia to attend the Kalaza conference. So I went to Khartoum, as you people know very well, because during that time, there was this compulsory recruitment into the army.
Yeah, right.
Yeah? What do they call it? What do they call in Arabic?
خدمة نظامية.
So I went from Omkura, I went to Khartoum, to process my traveling documents so that I can go to Addis for Kalaza conference. Now, at that time, all the medical personnel, الناس اللي كانوا شغالين في Saha or Wasara Saha, you have to do what do you call? Now, because I was working with a non-governmental organization, they said to me, you have to go and process, because I'm working within the health sector. I have to go to the Ministry of Health to submit an application so that they can exempt me, to do, the national service, military service. I went to the Ministry of Health. I found 3 doctors over there. I think there was a director of the hospital, I mean, of the, yeah, of the ministry. They asked me, say, Abraham, what can we do for you? I said, please, I'm working for MSF Poland. My boss actually asked me to travel to Addis to attend a conference for, Kalasa disease, no Maradal Kalasa.
No.
So they said to me, put an application, and then after 2 days, come to us. Abruma went after 2 days. They told me, no, you are not traveling. No, we don't allow you. You have to go for the military service. I was really disgusted. Now, they didn't actually ask me at that time that I have to go directly to the training, ground. They said, okay, we will send you a letter. So I went back to Omkura. I told Dr. Seaman and, our manager over there that, these guys rejected, to give me the papers to travel. So Dr. Seaman had to travel to Addis by herself. Now, myself, because they don't allow me to travel, when I was going when I was trying to go to Great Britain,
yep.
I have to change all my ID cards.
Documents.
Yeah, I have to change the document like a student. So I went to Khartoum, Abrum, because since last time they refused me to travel, they're not going to allow me if I use this document. So I went to, Chateau, Awat.
Yep.
Our Francis. So Awat used to work with us of Edna in UNDP.
Yep.
Near Sharani.
Yeah.
Okay.
Yeah.
Where
I know the place. Yeah, I used to go there. Yeah.
Work there. So I went to consult Awat if he can give me some ideas. He was a very good man. He helped me a lot during that time. So he said, Abraham, okay, I have got a colleague because he was a police officer.
You're right.
He said, I know a colleague over there in immigration. The office in Khartoum, Arab Souk Arab, isn't it?
Souk Arab, yeah.
Souk Arab, yeah. That was immigration over there. People process the papers.
You're right.
And then he wrote me a note. He said, okay, I've got my colleague over there. Go to him, tell him, what I told you. But also I found Obabo.
Castro.
I found Castro, yeah. I found Obabo. I explained to him, my situation. He said, oh, let's go. Yeah. He also, he was.
It's a helping, it's always.
So I processed my papers, Abrum, all successful. But again, I have to go to Street 60 or Luo Sharia 16.
Sharia 16.
Sorry, yeah. That was, like a security office over there.
Yes.
This is security guards. They walk around there.
I
have to take from them an approval as well.
Oh, okay.
I process the passport and also the ID cards. I have to go to them. Now I had somebody working with us with the MSF as like a driver. He's called Ahmed. He has a friend working over there. He said to me, okay, tomorrow morning let's meet over there. I will take you to them. So I went to these guys. They interviewed me. So why are you going to England? I told them, I'm just going for a course and I will be coming back. Now, this guy, Ahmed, who used to work with us as a driver, he had a sister living in England.
Okay.
So he said, oh, my sister is living over there, maybe you can visit them, something like that. So when my daughter was, when Hamra actually went to delivery, Emanuela, I was in Khartoum at Uncle's Billy house, traveling for England. So my daughter was born while I was traveling. I didn't see her. Yeah, since I came to Australia.
Oh, yeah. Abraham, we just go 1 hour and a half. So for you, it's not a 1 day meeting to be live on the Facebook here or in our program. There should be another program another day.
Okay, we will talk about that. Yeah, but I just want to say that when I went to Liverpool, I got my certificate in tropical community medicine. It was a good course, yeah. Well, that course, they taught us all the infectious diseases in tropics, all the diseases in the tropics, things like worms. And also we did something like travel medicine, and also we did pediatrics as well, children diseases, all these diseases which require vaccinations. They taught all those things, yeah. So I decided then to stay in England for 5 years until I came to Australia. Maybe next time we talk about Odugo language.
Yes, we'll be talking about Australia and Odugo language and Odugo community and leadership in Odugo community, all this. Okay?
Another thing I want you maybe in the future, if our people want me to select a topic, which I can use to educate other people, I can prepare myself and then I can come and talk.
Yeah, we can give them let them hear this in our show. If there's any comment, they can make a comment there. I believe you share in your Facebook. Did you share in your Facebook?
Yeah, I do.
Yeah, so if there's any comment there, you can pick up from there and we can talk about it later.
Yeah, I just want to conclude that.
Yes, can you conclude? Yeah. Yep.
Professor Billy Madison and also Mama Edna, our beautiful Mama Edna. They are very, very kind people. They look after us. In Khartoum, Abrum, my uncle was the only breadwinner at that time. So all of us were students. 20 people living in the same house. So my uncle can say, oh, no, I differentiate you from this one. So he treat us all the same. Yeah, I want to thank God, for keeping him safe for us. Also, yeah, I want to thank my wife also for taking care of me.
You're right. Abraham, Professor Dr. Billy is deserve somebody like you to talk about it, and all of us who can hear about his life, because he's very gentleman, He's a help a lot in our community, Odugo community in Khartoum, especially. In Khartoum, especially.
And many students, yeah. He is a professor in economics.
Yeah. So maybe we can find one good day, maybe in a weekend, next weekend will be good. So we'll talk about it anyway. Abraham, thank you very much to just come in our show to help and liberate all this good life of you and special. Sorry?
Meet all your listeners.
Yeah, right. You're right. So عايزين نقول لمشاهدين برنامج ذكريات في ايامنا، نقول لكم شكرا جزيلا. اخونا الفونس مرحب بك، مدام ماري مرحب، محمد مرحب بك. والله ناس ما شاء الله الليله ناس كتار جو. لورو مرحب بك، كريستين، تيتو فوغو from امريكا، الان لوجان from اميرات من قطر ما شاء الله، رومويان from كندا، عايدة مرحب بك. Yes. Andrew, yeah, Justin، ما شاء الله ناس كتار الليلة. فإن شاء الله مرة الجاية هنديكم اللينك، لو عندكم سؤال مباشر عايزين ترسلوا أو عايزين تشاركوا مع أبراهام will be good. هنتفق مع أبراهام في أيام القادم نشوف أحسن يوم بالنسبة له، لأن أبراهام يمشي ينزل شغل. فأبراهام, if you give us your weekend, one of the weekends next week will be very, very good.
I was actually for annual leave on a couple of weeks now. I'm going back to work tomorrow.
Okay.
Yeah, but I thank you for giving me this chance to come in.
Can we get any date from you, your weekend next week or something like that?
Well, I will let you know.
Okay, we'll talk about it.
I will let you.
Yeah, thank you very much. مشاهدين برنامج ذكريات في ايامنا، عايزين نقول شكرا جزيلا للدكتور ابراهيم وغيره، وهو طبعا يعني موجود معنا في ملبورن، وعايزين نقول شكرا لمدام بتاعه عمرو برضه ادانا فرصه عشان الليله ابراهيم يكون معنا. المتارجه ده له سنتين عشان كان ابراهيم يكون معنا في اللايف، والليله ظهر عندنا في اللايف. نقول له شكرا جزيلا عليك. الله تحياتنا لابناء كله، سلمنا العيال كله في بيت، ونقول للناس مشاهدين بتاعنا شكرا جزيلا، وان شاء الله نشوفكم ثاني. ف Bye, Abraham.
Okay, bye-bye.
Yes, yeah. Take care. Bye.